Welcome back. Today on Drop the Act, we're joined by two remarkable medical professionals whose jobs demand precision, composure, and exceptional communication under pressure. Together, Doctors Sophia Cashman and Benedict Sherwood offer a rare insight in what it means to lead, perform, and communicate when the stakes are real, and what the business world could learn from the surgical one. I'm delighted to welcome Ben Sherwood and Sophia Cashman to the Drop the Act podcast. Welcome, both of you. I was just chatting a little bit to Sophia before we came about the where Performing Perfectly started from, and I mentioned the Football Association, which I've mentioned many times on this pod. But our first sort of work after that was with the NHS, and it struck me that it's very fitting to sort of look at the world of theatre, my theatre, and the world of your theatre that is extremely different. So I wonder, just before we start, if you could just sort of give us a bit of insight into what it is you do, just to sort of set the background about who you are and your line of work. Sophia, let's start with you. Thank you.
So I'm a consultant neurologist working in Nottingham. I mentally consider myself at the beginning of my career because I'm at the beginning of my consultant career, but in reality I'm about 20 years in, through all the years and years of training. My scope of practice, I predominantly look after people whose bladders don't work, I'd say, who have difficulty peeing, can't pee, or whose bladders are causing them problems for their kidneys, mainly due to conditions like neurological conditions, so things like spinal injuries and people that have got a lot of things going on. I also deal with some slightly niche things like bad urine infections that won't go away, and people who have taken a lot of ketamine that's affected their bladder. That's a common thing at the moment. So it's a mixture of operating on people and then seeing them in clinics, and also some emergency work, much like Ben.
Ben, over to you.
Yeah, thanks, Chris. Well, like Sophia, I'm a consultant urologist. I've been around a little bit longer. I hope Sophia doesn't mind me saying. So we were just saying it was 32 years ago that I left school to go to medical school, and I've been in as a consultant now for 13, 14 years. So I work at, like Sophia, the big teaching hospital in Nottingham, and my practice is now fairly subspecialized into looking after patients predominantly with prostate cancer, but I also look after other types of urological cancer, such as kidney cancer. So a typical kind of week for me involves a blend of consulting and talking to patients about their diagnoses and about possible treatment options. And then, I'm responsible with my team for delivering surgical treatment for things like prostate cancer. One of the things that I do an awful lot of is operate with what's called the Da Vinci robotic system, which is a way of removing prostates and with prostate cancer through very small incisions using a robotic platform. And I guess that's probably the thing that I do most of, together with some other cancer-related surgeries. I guess woven into that, both Sophia and I do teaching in our responsibility as consultants in a teaching hospital, training the next generation of urologists. I think increasingly doctors and surgeons like us are required to have a bit of a managerial responsibility as well, which brings its own challenges in terms of leadership and communication.
I mean, you've just touched on so many things that we can pick apart through this podcast, both of you. I just going right back to the beginning. I mean, disclaimer: Ben and I were at school together. So when you say 32 years ago, that was the last time our paths crossed.
Sorry about that, Chris.
No, and we won't talk about the musical The Boyfriend that we were both in. We'll leave that to one side. As much as Sophia would probably.
I think I want to hear about this. Yeah, absolutely.
We'll do that afterwards.
Really don't.
Or that might even be an episode on its own, Sophia.
Perfect.
But obviously, we know with medical training, it's a very, very long process, and the knowledge and the skills and everything you need. But of course, at the end of all of that, what you are thrown into that situation is this face-to-face situation with patients, but also, as you just mentioned, with teams. Communication plays such an important part in that. And what was your journey into how you learned to communicate? Is that something that's touched upon in your training? Is it you taught the facts and the basics, and then you have to sort of learn on the job the best way to deliver the sort of news that you may have to deliver?
Yeah, I mean, I don't know about you, Ben, but when I was at medical school, it was part and parcel of the weekly teaching program. You'd have actors come in and you'd have communication skills lessons. And that's what they were. They were lessons. You were sat there and you had an actor and you were given a scenario usually, and then you would kind of talk through it and get feedback and feedback on your colleagues. And it all seems like a really great way to learn. And it probably is a good way to get into it to start with. But it's nothing like the on-the-job training you get from day one. And I think it gives you some foundations, but really it all pales into comparison from day one on the job when you really start interacting with patients properly. And I think that's really where the learning begins. And it's, some of it's trial and error, I suppose, but it's picking up little bits throughout your career from seeing it done well and seeing it done badly from other people that can really help.
And Ben, I mean, over to you and your thoughts on that. I suppose learning is one thing, but as you're saying, Sophia, stepping into the situation is something else. How do you prepare yourself for that?
Well, it's a very, very kind of critical point in the working day, really, the initial consultation with a patient, and particularly in my practice where a lot of those interactions involve giving diagnoses of cancer. And it may surprise your listeners to know that actually a lot of the time you're meeting people for the first time during the same consultation as you are informing them of a cancer diagnosis. So, it couldn't be a more pressurized situation in terms of communication, and it's absolutely critical that it's done correctly. And so I think, like Sophia, during our sort of training, you are prepared to some extent by being put under pressure as a student, being involved in simulated conversations with actors playing patients. But I think that, as Sophia's already pointed out, it really is about building a body of experience through years of exposure to the same types of interactions. And so you develop, if you like, a series of tools and approaches to those conversations, which is as effective as it can be. And actually, it's one of the parts of the job that, oddly enough, is both most challenging and most rewarding. It sounds like an odd thing to say when you're dealing with breaking bad news like that, but actually through refining your approach to it, and as Sophia says, learning from observing others and your own kind of trial and error, you do get to a point where that you can handle those conversations. And I guess ultimately you want to get to the point where that conversation has to be had, and you'd rather it was you that was doing it, if that makes sense.
Yeah, no, completely. And how do you build trust in those situations? I mean, these are very when we've gone straight into the deep end here with the seriousness of the conversations you have to have if you're talking about a cancer diagnosis. So, I mean, you've got two things there. You've got to gain the trust of the person you're talking to. You've also, I wonder, how much do you flex your communication style depending on who you're talking to, and have you thought about over the years how different approaches are needed for different people?
Yeah, I mean, absolutely. Yeah, that couldn't be more the case, that you're meeting someone for the first time and dealing with something potentially life-changing. And, within that short space of time, you need to rapidly develop an understanding of a person's personality, their expectations, their language skills, their level of understanding of the disease and the diagnosis, and you have to be very sort of agile in responding to that in terms of the type of language you use. And I think also to be measured about how much you kind of deal with in a certain sitting, and you don't want to sort of overreach in terms of what can be achieved within a fairly constrained period of time. I think in terms of preparation, it's very, very important to me, and I drum it into all of the trainees that come through my clinics to know exactly the details of the case before you meet the patient. And I think there'd be nothing more disconcerting as a patient to be faced with a doctor who's reading something off the screen or from the notes and processing it in front of you. I think that preparation has to be done before, so that when the patient comes in, you are able to discuss a plan and a diagnosis with them and deal them into that discussion appropriately. But you're absolutely right. The choice of language and style of communication, you have to be able to flex that depending on the type of conversation you're having. I mean, in terms of building trust, I think there's a really important balance between presenting something to the patient in a sort of empathetic and carefully judged way, but at the same time they absolutely have to trust that you are telling them everything, and that all those cards are on the table. And that can be very difficult sometimes, as sort of medics, with the sort of individuals generally that don't like to say things that upset people, don't like to be the person that sort of says something that has that effect. And sometimes you are faced with the full force of human despair, but it's so important that conversation has that openness and honesty to it, so that they completely trust everything you say from then on in.
Sophia, you mentioned the training that you went through. And it's how when we work with businesses, we talk about how important it is that preparation, that research, that rehearsal, really, whether they're talking to large groups, talking to their team, having one-on-ones, trying to make a sale. And I was chatting with Dan Lowes on the podcast, who he is a pilot, but he was part of the Red Arrows. And obviously the decisions there, when they're up in the sky and flying at that speed and being so close to one another, it could result in life or death. You operate in a similar way. You're the way you communicate, the decisions that are made. I mean, how is he spoke about how they would sit on chairs as if they were in the cockpit, and they would go through the whole routine before they then went into the planes to go up. They talk it all through. How much of that goes on within your world?
Yeah, lots. I mean, it's part of our day to day, even in all the different aspects we do. So in an operating list, we in the morning we all meet as a team in what we call the team brief, and we sit and discuss all of the cases of the day. And in that you'll have your anaesthetist, so the person who puts them to sleep. You'll have your surgical team. And then you'll have all the other really valuable team members. So all your nurses and the ones that scrub up and assist you with the operation, the people that bring you things in and out of theatres, the people that help the people go to sleep, sometimes your recovery staff, so the ones that are there when they wake up. And it's absolutely crucial that everyone's there and everyone's able to talk and discuss things. And, the whole sitting down and talking about it and bringing it down to one level is key, because although everyone thinks, all the surgeons in charge, it's not necessarily the case. It's about having someone leading a group of people that all have individual viewpoints and skills. And it's not uncommon in those briefs to sit there and talk through each case, and for someone to say, oh, actually, I heard this, or did they mention this to you? Or this is what we thought was happening and it's different. And it's not always who you think. So it's really, really crucial that we do that. And we do that in a variety of different cases. So operating, sometimes in clinics, you'll sit there at the beginning with your team and say, well, I need to see this person, you need to see this, or I met this person before and this is crucial for you to know. Ward rounds, when we go and see all our patients that are in the hospital, either because they've had an operation or because they've become unwell in some way. And we'll sit, and it's really valuable that our most junior members of staff have the opportunity to say, I don't know if you know, but yesterday X, Y, Z happened. It is absolutely key that everyone in the room has the ability to bring things up and feels able to do that and has the time to do that.
And how do you go about that? How are people empowered? I mean, we're sort of moving on to leadership. I want to come back to, I'll stick with communication, but within that situation, how do you empower the team around you to feel that they can have that voice? So
the most important is knowing who your team is, and not just knowing, oh, that's my scrub nurse, knowing that her name is, Sarah, and she really loves doing these cases and not so much these, and all the different aspects of it. And then I think being mindful and looking around, and if you see someone sat there not saying much, it's worth just checking in and making sure, you know, that they feel okay to talk and there's nothing they want to bring up.
And Ben, once you're in the operating theatre, you're prepared as much as you can. You've gone through the case. You've all spoken. Obviously, you never quite know, I imagine, until you start the operation, exactly what you're going to find. What about the choice of language, the speed that you need to be able to communicate quickly and effectively if you're in a situation where someone's life is possibly at risk? How does that communication work?
It's a good question. I think there's two sort of aspects to this. I think firstly, and Sophia's touched on this already, is that we work in teams in theatre, and those teams are absolutely critical in terms of their composition and the extent to which we know and understand each other. And that develops to the point where when things get difficult, that is understood and recognised at the earliest possible opportunity, almost without any words needing to be exchanged. My scrub nurses that I've worked with for years and years and years will know very well when I'm under pressure, and will respond to that in very constructive ways by mobilizing things, getting certain instruments ready that they expect and anticipate may be needed. When it comes to sort of exchanging, and instructions and requests, etc., then that has to be very clear. You have to articulate that really clearly, and there are obstacles to that. We often wear surgical masks. In my robotic surgery, I'm physically separated from the rest of the team in a console in another area of the operating theatre. So sometimes to really deal with a difficult discussion, I may need to come out of the console so that we're looking at each other, we're connected in that sort of human way, so everybody understands. I think that there are certain points when things are getting tense that we'll need to have absolute focus on the matter in hand. So sometimes I will operate with some background music that will be off. We'll need quiet in the room, and conversation and discussion will be very limited exclusively to what we're dealing with. So there are those sort of practical things that you can do as well. But I think it's about having the right people in the room with the right level of understanding of themselves and each other, and how we communicate and what our needs are going to be. And it's it is really highly developed. I mean, in our case, there are lots of things happening in anticipation of a problem, even if that doesn't actually turn out to be the case. There are people who will, when my kids were young, would ring up the nursery and say I was going to be late to pick them up. It's that level of communication and teamwork that's required in an operating theatre to really make it work.
I mean, that collaboration is so important, Sophia, and then the teamwork is so important. I wonder if there's anything you can think of from that operating theatre that businesses could think about, could use when they're thinking about the way they collaborate with their teams.
I think, Ben was touching on what happens when things go wrong and when it's getting stressful and everyone knowing each other. But I suppose you have to bear in mind that people do change, and you don't necessarily have a team inside out. And if you're getting stressed and they don't know this and don't know why, it will start to break down because they can't then anticipate the problems. So if you think something's not going right and things aren't around you happening as you'd like, it's about making it clear why this is happening, or maybe stopping for a minute and saying, I think there's a problem here. I'm going to need X, Y, Z for us to kind of get through that. And sometimes you do need to be firm in a polite way to get the right attention, because it's a noisy environment. There's lots of people around. I'm sure it's the same in businesses, offices, businesses have lots going on. So a way of making it firm point that actually we need to concentrate on this, or this has happened, I've spotted, without coming across as rude, and without going ahead in your own head and jumping ahead without bringing everyone up to speed with you, because then you're getting stressed about something, you're not getting the response because they don't know what you're stressed about, and it will all lead to a breakdown. Whereas if you kind of make it clear and take them along with you, then you'll probably get more of a response and get through it safely and effectively.
Ben, Sophia's just touched there on sort of pressure and high stakes and possibly feeling stressed in obviously in these situations. I wonder if you could share a moment where the stakes have been particularly high, where the pressure's been on you, and how you've maintained composure, how you haven't fallen apart in that situation.
Well, I think that there's lots of times that over the years where operations have become very difficult, and I could talk about a number of situations, but certainly one that I'll never forget, a patient who's having a very large kidney cancer resected through an open incision, and it was recognized really from the outset before the operation that this was going to be a fairly high acuity operation with a high level of risk, and the discussions with the patient were had beforehand to prepare the ground for that. I think being prepared is a fundamental part of going into surgery like that, so that you imagine the worst case scenarios and ensure that all of the provisions have been made for that as far as you possibly can. You need to choose and have support from suitably skilled colleagues. So very often in modern surgery, these sorts of operations are undertaken in collaboration. So I wouldn't be the only consultant there. You'll draw on the experience and skill set of another surgeon. And having someone else present with you is a hugely valuable resource. And I think that increasingly surgeons are very welcome and receptive to doing cases collaboratively with colleagues. That there can be no place for ego or pride. If somebody else can make that easier, can lend a particular skill to the situation, then absolutely get them involved. So yes, preparation, having the right individuals there in this particular case was absolutely valuable, making sure that the patient was totally informed as to the risks of the operation. And then actually things did get hairy. There was a significant amount of blood loss, so it was important to keep the dialogue going, and to, as Sophia very eloquently described, to bring people up to speed with what's happening there. I think it was extremely helpful to have people like my anaesthetist, who's fabulous, to say, okay, I'm going to look after this side of things. You just focus on what you're doing, so that there's a very clear understanding of who's dealing with what when things are tight. So you're allowed to focus just on your particular kind of field of view, what you're doing. So that support from colleagues was absolutely critical. But I remember that because I went to see this chap. Thankfully, we did get through the case, and he went on to do well. But I went to see him the next day on ITU after several hours of operating and a huge level of stress. And I asked him how he was doing. He said, "Yeah, and I told you I'd be all right." He said the next day, and I said, "Well, that's fine. You might be. I can tell you I'm not. I think I've aged about 15 years."
It's interesting because I remember I had a heart procedure quite a few years ago now, 5 or 6 years ago. Very simple ablation, nothing complex at all. And afterwards, the doctor came to me just to check on the wound where they entered and make sure that I was going to take it easy. And he said, "What do you do for a profession?" So I told him I was a theatre director and told him about Les Mis. And he just was like, "Wow, this is incredible. That's such an amazing job." And I was like, "I've got to stop you. I'm sorry. I've just watched you insert, something into my body. I've watched it on camera as you've burnt the area of my heart, fixed the electrical fault. And from this moment on, I'm feeling absolutely fine." I was like, "That's incredible." But he just seemed, he took it in his stride, and to him, I suppose, like a lot of us, it becomes every day. It becomes a normality. However, Sophia, it's you're constantly learning and adapting, and things are changing, and the pressure's there. How do you stay present? How do you make sure you can perform at your best in every single situation with everything else that's thrown at you in life, whether it's professionally or personally? What are your skills to step into that zone and be present?
Well, it's hard, isn't it? And it's hard for anyone in any job. And I don't think we're unique, that we're in a high stress job. I think the stresses are different in different jobs and the stakes are different, but everyone faces it. And I think the key things are making sure that whatever the thing is that's important at the time, be it an operation, be it talking to a patient or a relative, you park everything else for a few minutes and don't try and multitask. You know, there's times for multitasking and times for definitely not, and parking things when you've got something stressful that you need to do so you can focus on that thing and then come back to it. And, you know, on the emotional side of things, if it's a high stress situation, that's our burden to bear as professionals. We need to come up with a way of getting through that situation, and then you can go and dwell on it later in your own time, but not at that point. You need to focus and then make sure you're giving it your full attention.
Ben, we mentioned earlier just about communication with patients, and I can't remember exactly what your comment was, but seeing people, the full gamut of emotions from the people you speak to, you know, how have you managed to, in those situations, how has communication played a part in how you've managed to calm, how you've managed to control? We talked about gaining trust, but there needs to be clarity and calm in situations. Have you found skills or methods in those environments to be able to communicate effectively?
Yeah, I think in terms of how you communicate with patients and maintain that level of calmness and composure, I guess I have. And I think that I said earlier on to recognize how much ground you can realistically cover in a given space of time is really important. And Sophia touched on this as well. You know, we've got to create a remit for that consultation and the time that's allowed, and make sure that there's sufficient space there. I think patients need to be given an opportunity to react to what they're being told, and sometimes that involves a period of silence during the consultation, which I think is important, just to let things sort of land and judge a response. We'd always encourage patients to bring someone with them to provide that emotional support. And the way we deal with some of the cancer diagnoses in Nottingham is to, once patients have had some time with me to discuss the diagnosis and some of the initial decisions about treatment, etc., they will have a second opportunity to discuss things with a specialist cancer nurse. And we've found over the years that by breaking the consultation almost into two halves, that's been a very effective strategy for patients to be able to reflect on something that they've been told, and then have a second opportunity to revisit certain things. If you try and cram all of that into a short space of time, I think there is a risk that things can become emotionally overcharged and crammed, and you try and cover too much ground in one sitting.
Sophia, I'm sort of jumping back to the training again, and that idea of thinking about how you communicate, but also, you know, we talk a lot about body language, and I wonder how much of that is present in your thoughts when you're having those conversations, and whether you think about mirroring or matching or tone of voice or the way you're sitting or the way you communicate. Does that play a part, or is that something that comes naturally?
I think it's definitely something that plays a part, and that's one of the things you are taught from early on. You know, how you come across, the body language you use, the gestures. It's all skills you are taught in communication skills. But how that embeds in your style is something that comes with time. So you don't have to think about it actively; it just happens. And we've always got a lot of barriers in medicine. Like, I'm sure you'll know, if you go into a room, quite often you've got a desk, a bit of physical barrier, desk between you. So if it's a hard conversation, you need to, you know, moving those barriers, moving your chair around so you can talk to them in a more affable style. Sitting down is really important. You know, ward rounds, we're on foot, we're walking around, and these are people in bed, and it's quite unpleasant, isn't it, to have someone leaning over you, talking to you, especially if you're getting quite difficult news. It feels quite in your face. So pulling up a chair takes seconds, and if you need to sit and have a difficult conversation, then that's what you need to do, and bring yourself down so there's not these kind of barriers and different levels between you to try and open it up. Mirroring, I think, is something that happens without you even realizing it with time. You know, a patient becomes closed off. You've got to be conscious that you don't sit back with your arms folded, because it's very easy to slip into bad mirroring as well as good. So those kind of barriers, it's really important, because it definitely does set the tone, and it definitely alters the way you're perceived, and that will alter the way it continues and how you can communicate well.
And Sophia, is there sort of one lesson about human connection that you've learned from your patients that that you'll never forget, that you could share with us?
I don't know. I think patients teach us things on a daily basis, and just when you think it's going well, they'll pull you up on something and make you think, actually, you know, you need to focus on it. I think for me, the most important thing is each interaction you have, it might be one of 100 we've done. And, you know, you talked about your heart procedure and said, oh, it's relatively minor. But for that patient, that is a big step in their lives. It's a big moment for them. It might be their first time ever being in hospital. It might be, and something that might be minor on the scheme of things isn't necessarily for that person. And like, we do these things called flexible cystoscopies, which is cameras inside the bladder that you do under local anaesthetic. And I think most people have done thousands, if not more, of these by the time they reach consultant level. And they can feel a bit run of the mill, you know, quick procedures. And some of our patients have already had 20, and they are. But every single person you see in that clinic, it might be the first time they've ever had anything like that. And you really need to be mindful of the impact you're going to have on that individual, because you can't make a first impression twice. And you can't reshape their first impressions of your service, the NHS, and of you as an individual. So you know, you need to make it, each impression and each interaction with a patient, you need to be mindful that this is not run of the mill for them.
I'd love to just chat a little bit about leadership. Obviously, Ben, I know certainly you mentioned that you lead a team. Sophia, I think you do as well. Sorry, apologies if I've got that wrong. But you're leading, obviously, in the operating theatre, and you've been led as well. What does good leadership look like in the NHS? What does good leadership look like within your team, and how have you developed and moulded your own leadership skills? Ben, let's start with you.
Yeah, I think there's a number of things here. You know, I think that having a leadership style is a sort of natural process, and I think the mistake that can be made is to have a vision of what a kind of surgeon should behave like, how they should lead, how they should interact with their team, and kind of aim for that. I know that you talk a lot about authenticity, and I think that's really fundamental here. To have a good relationship with your team, to lead well, you've got to be your natural self, I think, in the work environment, and people will rapidly see through any sort of front that's being affected for any given situation. So I think, and that extends to not pretending to know the answer and to have the solution to a problem all the time. In fact, the best people that I've worked with have been those that have been most willing to say, look, I'd never come across this before, or this is something that's totally unfamiliar to me, or to say, you sound like you know a lot about that, you know, I'd really like to know more. That acknowledgement that you are receptive to learning, you recognize that other people have got that contribution to make, I think makes you a much better leader. That would be my view of it. So I think to recognize the skills of your colleagues within, let's say, the multidisciplinary team, to actually publicly acknowledge that, to say, well, you know, I'd really like to hear from Dr. So-and-so, if they're the radiologist, or from the specialist nurse or dietitian. This would be something that you could no doubt lead on, to empower people, to acknowledge their skill sets, and in any discussion, in any kind of leadership scenario, to give those people a touch of the ball. That, I think those things are really important. And I think that, you know, having that ability to recognize the contribution that other people have to make for surgical care to work well, to bring people into play, and never ever to pretend that you are the person that makes the decisions because you have all the answers. I think that's what modern leadership should look like in the NHS, truly a multidisciplinary affair. I think having said that, there has to be leadership, and there has to be somebody that can build consensus, can pull those thoughts together and crystallize it into a plan of action. And I think that's really the role of a leader in our business.
Sophia, same question for you, really. I mean, stepping into the world you're in, how have you modeled your leadership?
Well, I mean, it's at the moment, I think each stage you get to, you look forward as you look at the next set of leaders and realize that throughout the NHS, you're always part of the team, and you're also leading some form of team from almost being a medical student onwards. There will be a team you're leading, and you build skills by looking forward at who's ahead of you and things you would and would not take on yourself. And to an extent, looking behind you and thinking, did I do a good job in that role? Is there something I could have changed? And trying to mold to make sure you're using your own skills. And as Ben said, all leadership styles are different, and don't take on ones that don't suit your character or your personality, because not everyone can be, or wants to be a didactic leader who's quite, enthusing the team from the front. Some people lead very well from being part of the crowd. And there are times in almost all roles where you do need to take the helm in some way. But the way you do that can be quite different, and I love that because the latest leader I've had is Ben, ironically, because he's been head of our department for the past however many years. So, yeah, I'm not going to say what I have and haven't taken from that. But
put you on the spot.
But there's so many, yeah, exactly. But there's always something to learn from people ahead of you, and there's always something to learn from whatever you've just tried to do.
And in these high pressure situations as a leader, how do you come across still as composed and credible in a situation where something's going wrong? Because it's the unexpected can happen.
Well, the first thing is trying not to go into it in a stressed out, unexpected way. They always talk about that HALT, don't they? Hungry, angry, late and tired. If you're going into a meeting or a position of leadership or something you can predict, make sure you're on your best form to start with. Because we've all had those meetings that have gone wrong, where you've gone into it and come out and thought, oh, I haven't done very well in that, or that didn't go as planned, or, not everyone in the room seemed happy. And if you go into it in a stressed out, rushed, late, couldn't find parking, etc., skip breakfast, you're not going to do very well in those situations. So I think it's the prior preparedness and making sure you've got your best self available. And if it's the wrong time and it's possible, reschedule it.
Ben, I love the idea of the comparison with even with the word theatre, and I'm just thinking about the days when I was stood in the wings waiting to go on stage, and the nerves I was feeling before standing in front of an audience, and the worry about what lines was I going to forget, was I going to hit that note, and how I would prepare myself for that situation. And then I'm stepping on stage and I'm very much giving a performance. That word performance within leadership, you've mentioned authenticity. You need to be authentic, but I suppose two parts to that question. Firstly, how do you prepare yourself when you're stepping into your role? How do you build a resilience, I imagine, is needed with some of the things that you're going to face? And then is there a performance involved? Are there different versions of you that you find yourself stepping into to get the results you need?
Well, absolutely. I mean, I think in terms of preparing for let's say, an operating list, I think you have to pull back on your training to a large extent. These are things that we've been doing for a long time, and increasingly in modern surgical practice, doing the same thing an awful lot. So there is you're intimately familiar with the procedure, how it works, and over time you become exposed to any number of different ways that things can work out and go wrong. So it becomes a lot easier over the passage of time to prepare yourself for surgery, and the anxiety associated with it does certainly decrease, but never disappears altogether. And I think you become, more adept at spotting things that are going to be difficult in advance, and then the focus on preparation there becomes absolutely vital. Sophia's already mentioned briefing the team before surgery, and I think that's that's hugely important, and it's an opportunity to share your concerns actually about what may be difficult, what might challenge you during a particular case, and focus everybody's attention on that. I always say to my team that the more I worry about a case in advance, the easier it's going to be. So I make a point of sort of over worrying and over preparing for something, and then generally speaking, you are pleasantly surprised how straightforwardly it's gone. I think the times when it really tests your mettle is when you hadn't anticipated a problem and then something crops up. And again, it's about falling back on your training. It's about clarity and maintaining communication with your colleagues, and being willing and ready to communicate the difficulties you're having and to ask for help. Those things are vital ingredients. And there was another part to your question about, you'll have to remind me, Chris.
Well, it was about the preparation. It was about resilience. It was about, is there a performance involved?
Yeah,
step into a version of yourself.
Well, I think that is true to a large extent. You do have, you have to get in your game face on, when you're going into a difficult consultation. But I'd agree with you. I think it's not to be inauthentic. You have to be genuine. You have to be totally invested, and patients have got to trust and believe exactly what you're saying. And so yes, a performance in so much as you're preparing, you've got to deliver a certain message and get that across effectively. But at the same time, they need to know that they're dealing with somebody who's genuine, who's not putting up a front or you're not being themselves. It's quite a difficult balance to strike, but I think it's really important. So I do accept that at different points in the working day as a surgeon, you are, I guess, shifting roles to some extent. But I think within that, you can very well, be yourself and not to try and, put up a particular front.
We often talk about the idea of there's eight shows a week for a performer, and each audience member's paid the same amount of money, often quite a lot of money, to watch that show, and they deserve the same performance every night. So whatever's going on in your personal life, however you're feeling, you've got to step into that role and you've got to deliver to a high standard. And I feel like that pressure obviously is there for everybody in business, anyone who's doing face-to-face, anyone who's working with a team. But I suppose in your line of work, that pressure is that little bit higher, just purely because of what's at stake for people. Sophia, resilience plays a massive part in all of this. Have you found that resilience grows with experience and the situations you find yourself in, and how you manage those situations?
I don't know if it's resilience or experience. You've seen it before. I think, to me, resilience sounds like you're kind of immune to the stress of it, but actually each thing that goes wrong in your career, it hits you just as hard. And I think it's more about the more time you spend doing it, the more, as Ben said, the more you've seen it all, and you might prepare slightly differently and, understand different ways of doing things. But, your analogy of performance, we were talking earlier about how different jobs, you do find funny coincidences in how you prepare. But for us, each, performance, each operation or each encounter with the patient, for that individual is, for them is very, very, very important that you're on your A game. You can't ever slip. You can't be, midweek tiredness. That can't exist. So you've got to find a way of shaking off the last one and making sure you address it as a new first performance each time.
You lead in life or death situations. So is there one sort of brutal truth about leadership that most business leaders really aren't ready to hear?
Well, I don't know if they're ready or not, but I think it's important to understand that not everyone is always going to like you and necessarily like the way you do things, but you have got to be able to kind of ensure that relationship, it commands some sort of mutual respect, even if you disagree with one another, to make sure that whatever's needed can happen. So you might have colleagues you don't get on with, but you need to respect each other enough and communicate effectively enough in certain circumstances that you get the job done.
Ben, that point there by Sophia, again, we're going back to managing teams and working within that. How do, if you have got people with very differing opinions, how, I'm sort of thinking like me as a director now, and how I sort of have to direct people to sort of be where I need them to be on stage, how I need to, I don't want to use the word manipulate, because that's, manipulate can be a positive word, but it never sounds like it. How do you work with a team to get them all going in the same direction when there's differing opinions around the room?
I think it's made a little bit easier for us in our business, because we are ultimately, we exist to deliver the best possible surgical care for our patients, and that gives us a really clear agenda to work to, and something that everybody will sign up to, and actually it makes teamwork a little bit easier, because wherever there is a difference of opinion, it's all, it shares the same intention. How can we get the best outcome? So I think that, generally speaking, where there are disagreements about the best way of doing things, there is, and certainly should be, an openness and for people to be receptive to new ideas and different ways of doing things. So actually, I've generally found that building consensus is quite straightforward. If somebody can describe and provide evidence for a new way of doing something, then we as doctors ought very well to respond positively to that and be willing to incorporate that into decisions that we make. But yeah, I mean, there's always going to be tensions, and I think people have to be given enough space to express their view and the rationale behind it. And then a skilled leader in healthcare will kind of build consensus by pulling all of that opinion together. It's very rare for there to be kind of fallings out about patient care. I think because of that agenda, everybody wants the best for the patients, and that's what we do. I think that the disagreements are generally about sort of politics and management outside of patient care, in my experience.
And just speaking about politics and management, how much pressure is there from the outside world? I mean, the NHS, we all value the work that you do tremendously, but of course it's very public about funding or lack of money, and save our NHS, and are we trying to privatise the NHS, and what the latest government take on is. I mean, do you just have to shut out the outside noise, or does it have an effect on work and everyday work?
I think to a large extent you do have to shut it out, Chris, and I think that our job is to do the very best we can with the resources that we're given. We're absolutely aware that there are financial constraints and resource constraints in everything we do. In some ways, that can be a positive driver. When you know that there are finite resources, it means that you will always look for doing things in the most effective and efficient, cost-effective and evidence-based fashion, and that's a positive driver actually in the NHS. I still think it's the case, and I don't know what you think, Sophia, but most of the patients that I deal with are lovely people, and they're really grateful, and they recognise that there are funding issues and resource constraints in the NHS, but they don't blame doctors for that. They don't come into consultations with any sort of hostility about that. They are able to see a very clear line of separation between what we do and what we try and deliver, and the basic resources that we're provided with from the government. So it's very rarely compromises our relationship with our patients, thankfully.
Sophia, I'm going to give you the final word. I'd just love you to give me sort of three, I'm putting you right on the spot now, three of your sort of top tips when it comes to effective communication. Three things that people can think about their takeaways, whether it's communication, leadership, or anything involved that you've learned along your way, or something that someone has said to you that has stuck with you along your journey, that has helped set your path as a leader in the NHS.
Gosh, on the spot. So I'd say number one is know your audience, know who you're talking to, if it's patients, colleagues, staff, whoever it is, because you can put your foot in it quickly if you don't. And number 2 is know your stuff. Like, if you don't know what you're talking about, don't fluff it. Don't try and talk as if you do. Either don't have the conversation until you do know, or tell them that you don't know. So you've got to be honest about the do's and don'ts. And lastly, I think it goes back to what we said earlier about each communication episode you have. You need to consider the impact that's going to have on the other person, because the way you deliver can completely change how they respond and how they feel in that time, and that can completely change their experience. And that's not just, patients and delivering bad news and how it's delivered. It's basic conversations with colleagues, and it can really have a big impact on their understanding of what you've said and their day. And we all talk about civility saves lives and that kind of thing, but actually each interaction you have can really alter other people's experience, and you need to be mindful of that at every point.
Thank you. Ben, just going back to your year 10 performance in The Boyfriend at high school.
Yeah, I want to hear more about this.
And, the amazing vocal performance. How much do you think about pitch, tone, and pause and pace and vocal delivery when you're communicating after your wonderful turn in the musical?
Yeah, no, those skills have never left me, Chris. You'll be pleased to hear. I use them every day.
Good. I would hate for them to go to waste. Thank you both for your time. Thank you for your insight, which is into a remarkable job that you both do, that everyone is extremely grateful for, and I think there's a lot of takeaways there that people can take from the high pressure of your industry and put into their own businesses. So I really appreciate your time. Thank you, Ben and Sophia.
That's a pleasure. Thanks very much, Chris.
Yeah, thanks for having us.